I released this video over 1 year ago. This video depicts a man suffering with kidney disease secondary to anabolic steroid use. I'm releasing this video again with this introduction to bring attention to a specific type of kidney failure that I'm seeing in men that are using anabolic steroids and that are weightlifters. We have to understand that we've seen this before, and I've been seeing this for years. And I'm seeing more and more of this type of kidney failure coming into my office. In the past 3 months, I've seen 3 patients. And currently in social media right now, we have someone that is telling the world about his kidney failure. This type of kidney failure was discussed in an article by Dr. Leo Hurwitz from Columbia University in 2010. The title of this landmark research paper is Development of Focal Segmental Glomerular Sclerosis After Anabolic Steroid Abuse. We learned then, as I've learned up until this time today, that certain men who use anabolic steroids will suffer this specific condition, FSGS, and we're still learning about the etiology of it. But I could tell you that if you use steroids, you have to understand that you're running a risk of kidney failure. And it won't happen overnight. It won't happen in 5 years or 10 years, but up to 20 years or more, it usually takes, and this could happen to you. And the other patient comorbid conditions that we see would be hypertension. Very important to monitor this. Understand a baseline creatinine. Do not use too much protein. Essentially, don't get too big. This is what this paper is telling us. This is what it shows us. It's very interesting. We don't understand. Just being the body mass appears to be toxic to the kidney. Again, we're not clearly sure on all this, but I have to tell this to people. And then non-steroidal anti-inflammatory agents can be toxic. When you put all these together and you line all these up with a certain man who is susceptible, this is what I'm seeing. In the past year or so, even the past 90 days, it's been incredible. I don't know what's happening, but all these men are coming in different degrees of kidney failure. So please, please contact my office and do a consultation. If you don't feel comfortable doing a consultation with your own doctor. I work all around the world. It's been great. We have Skype. I have a practice here in Connecticut. I have an open practice that's new in Fort Lauderdale. You need to get your blood pressure monitored. You need to understand your basis for your health at baseline. You need to check your kidney function, not to mention cardiovascular function, full detailed family history. You have to understand what may happen to you. I leave this up to you. Please, please make the right decision. Thank you. Enjoy this video. I hope this video really helps people. Thank you.
Hi, welcome to In the Clinic with Dr. Thomas O'Connor. Today is a very, very important day and an incredible day for me because I'm able to introduce and take care of someone that I was a big fan of actually for many, many years. We're about the same age. This is Joe Ladnier. Joe's a famous guy, certainly in the world of weightlifting, powerlifting, and bodybuilding. And Joe's come into my life. He's going to be a patient of mine. He's allowing us to present this video. This is a very important video. Unfortunately, Joe has had some medical issues, and it's specifically regarding his kidneys, and his kidneys have been damaged. And we're going to talk about that related to anabolic steroids today. And it's a very important video, and it's an educational video. Joe, tell us, first off, more about yourself and about some of the amazing historic things you've done as a professional in the weightlifting world.
At the age of 19, I won the men's national championships in powerlifting, breaking the men's world record total in the 220-pound class. I was the first one to break the 2,100 pound barrier in the 220-pound class at the age of 19. And to this day, I still hold all those teenage records. They were men's world records at the time in 1983, But today there's still teenage world records, so I still hold the 837-pound squat, the 523-pound bench, the 749-pound deadlift, and the 2110 total, and the 220-pound class.
And this is without the assistance gear.
Very, very light gear back then in 1983. A marathon squat suit would give you maybe 30 pounds.
I remember it.
Yeah.
So bring us through the years, and let's talk about steroid use. Tell me when you first started using steroids.
I started using steroids when I was 19. I used them from 1983 to 1986. 1986, I ruptured my right patella with a 900-pound close stance squat, and I went drug-free, and I didn't use any steroids. I still competed, but I competed drug-free. I didn't take any steroids from 1986 to 1999, and then I started competing in bodybuilding again, and that's when I started taking steroids again, and I've taken them almost the full time since 1999. There was about a 2-year break that I didn't take steroids, but I have used them since then.
Can you tell us the steroids that you've used?
I don't know if there's a list long enough. In the early days, I was known as the experiment. The trainer that I had, anytime a new drug came along, he would give it to me. He would say it was the main drug of the Europeans, and that's what I would use. I've used every type of testosterone, Decadurabolin mix, Trembolone, Blastrone, Maxibolin, Dynabol, Anavar, Anadrol.
What's your favorite drug?
Believe it or not, Equipoise.
Which is a veterinarian drug.
Yes.
Interesting. Do you feel like a horse when you ride it?
I get a craving for hay and like to neigh a little bit. No, it does make your nails grow very quickly. It does make your hair very healthy. Makes you very vascular. It thins out the skin. You don't retain any fluid on it. That's why a lot of bodybuilders like it.
Interesting. So over this period, did you have any health issues? I mean, you've been on steroids 30, how many years was this straight?
Altogether about 26 years.
20 straight years on steroids. Why didn't you come off?
Competition.
I mean, I'm not going to ask why do you do, I'm beyond asking why do you do steroids. And I take this is very serious, by the way. Everyone knows that I'm the expert medically for this, and I'm humbled to do it. I don't give a blessing on steroids. I'm simply discussing and looking into why men use them and what I can do to prevent the use and, of course, the damage and the medical damage to reverse that. And today's case with you is incredible. This is a landmark case today.
Well, I started using steroids in the first place because during that time, steroids wasn't looked at as hard as they are today.
But everyone's on steroids today.
Yes, but back in the 80s, when you would join a gym, they'd give you a bottle of Dynabol.
Really?
Yeah.
Wow.
That's the way it started with
I remember up in Syracuse.
Yeah.
I don't think they were handing out, there was a dog walking around with a little pack on. They got some D-ball in there, I'm not sure.
Yeah. But I mean, today, I have, owning a gym and training people, being a trainer, I have housewives come to me asking me for Anavar.
Isn't it crazy? I mean, this is why we're doing this.
Yeah.
I mean, we got to talk about it. This is insane.
Yeah, I have construction workers that are on massive dosages of steroids, and they're not even lifting weights. They're just doing it for the cosmetics. They think if they take the magic pill that they'll blow up like Arnold Schwarzenegger.
Before we move on, let me ask you a question. So you are obviously an elite, in all the worlds with no arguments, an elite powerlifter, for sure.
Yes.
You're in the circles of those. We both know the names, and we won't have to go into names. And is that okay to do it? I'm wondering, is that okay if you're genetically gifted, you can use steroids because everyone else is, versus the guy you're talking about that's on the couch that does it because he wants his arm, and he just likes, maybe I see a lot of men that use steroids for sexual purposes. What do you think?
Well,
Is it
yeah.
okay? Is it okay because you're a gifted guy or something? Versus the other kid, hey kid, come on, it's not going to do anything for you. You're not going to be like, I'm being real.
Right,
This is what
right.
men tell me. Kids, you shouldn't do it. I can do it, but you can't. I mean, it's kind of hypocrisy.
Over the years, I've come across people that I've trained and trained with that would train the same, eat the same, take the same drugs, but they were nowhere near what I was.
There's no
strength
question.
wise,
Genetics.
and they couldn't understand it, and there was a lot of jealousy in the gym because of that. I've run across every type of athlete there is that takes steroids. Golfers,
Yeah.
of course, baseball players, football players, wrestlers. I mean,
But you know that the main person using steroids today is the non-competitive athlete weightlifter.
yes,
And a man, but the women are up there too. And
Yes.
we're bringing attention to that.
Yes.
Joe, let me keep moving through. Let's go right into your medical issue. Tell us what happened.
January 20th, I was in Mobile, Alabama, running some errands, and I wasn't feeling well. I felt like I was coming down with the flu. Body aches, runny nose, cough. And I decided to stop by urgent care. I called my wife and said, I'm going to stop by the clinic and get a flu shot. While I was there, the first thing they did was a nasal swab, and they said, yes, you have swine flu. They took my blood pressure, and it was somewhere around 238 over 138. And they immediately did an EKG, and the doctor there said I had a heart attack. He said, you need to go to the ER right now. So I went to the closest ER, which was about 5 miles away, and the first thing they did when I walked in was an EKG. Everybody started laughing and said, well, I guess urgent care can say what they want. You didn't have a heart attack, but your blood pressure is high and you need to stay for observation. So during the next 2 hours, they start doing blood work, and they came back and said, do you realize your creatinine level is at a 6.9?
So you're
7 being renal failure? And I said, no. They said, do you have back pain? No. Do you have blood in your urine? No. Do you have a problem urinating? No. I had no idea. I said, I was doing 600-pound squats yesterday for 5 reps with this blood pressure and didn't know it.
Wow. So they kept you in the hospital.
They kept me in the hospital 5 days.
They ruled out the heart problems. You ended up calling nephrology, which is this is what we're going to get into today. And they diagnosed you subsequently with a condition called focal segmental. You had acute renal failure. They
Yes.
call it acute on chronic, and it's focal segmental glomerulosclerosis,
Right.
FSGS. And it's quite arcane. It's quite rare. We do see it though in the weightlifters. We've had history in the past with literature, which we're going to go into. And you didn't know it, but you know it now. So bring us through that period. So you were really what's called acute on chronic. You had chronic. You were walking around.
They listed me at stage 5 kidney failure.
You were walking around with chronic renal failure, and because you just didn't have medical care with creatinines and lab work, and I asked you how'd you feel, and then what'd you say when I asked you how you felt then versus now?
I was sluggish. I had no desire to do anything except my workout for the day, and that was it. I had no energy.
But you were living like this for months, if not years.
Yes.
It's
Yes.
just incredible to me.
Yes.
Otherwise-
My only focus in life was squat, bench, deadlift.
It's understandable. I understand where you're coming from.
And it was that way for several years, and probably the last 7 years that my wife and I have been married, that I've been competing again, that was my lifestyle. I mean, she would ask me to work in the yard, and I was, you kidding me? I'll get out of breath. And or we'd park too far in the parking lot from Walmart, and I'd say, drop me off at the door. That's too far to walk.
So and we've talked about in the past, I've heard guys say, you know what, Doc, I felt like crap, But it's okay to feel like crap 23 hours out of the day, because that 1 hour I'm training, that's okay. I'm feeling great.
I could squat 800 pounds.
That's just incredible. So that's just amazing. So moving through, so you were diagnosed with a condition called focal segmental glomerular sclerosis, FSGS. I found some literature on it, and as you know, even before you came, that there's some other pro bodybuilders. I will never say names, but the names are probably known, and you know who they are. And they've had this. We're not sure clearly exactly what causes it and who's at risk for it, but if you just basically look and do the basic research on it, you'll see that it's a nephrotic syndrome, which means you're peeing a lot of protein, okay? And it's really unknown damage to the kidney. People present with shortness of breath, with edema, and I think you had a lot of lower leg edema during that period. There's other things. If you look at the labs, I mean, you're going to see the creatinine is elevated, the GFR, estimated GFR is down, cholesterol levels are secondarily elevated, there's some low albumin levels, and blood pressure, it will be off the chart, in most cases like yours. It's called malignant hypertension. So the causes that I said are idiopathic, means we don't really know. There's some genes on it. And this is the primary. What the doctors are saying here, when I read these notes, and we're going to talk about a study at Columbia University years ago, they're saying it's secondary. FSGS is secondary to anabolic steroid use. It's certainly possible. When I look at the study, and I've done my research at Columbia University in 2009, development of focal segmental glomerular sclerosis after anabolic steroid use. I'm an evidence-based physician. I'm presenting the evidence here. This is a study of 10 bodybuilders that presented in renal failure, and these doctors there compared them to a control arm of obese patients. Because if you look for the etiology in FSGS, it's unknown. Secondary is obesity, sleep apnea, viruses, autoimmune. So of course we're going to work and try to find some of these, the smoking gun, if you will. And we're scientists, so we're going to say, yes, anabolic steroids based on this account, and I'm going to call these doctors. We're going to try to get you into that registry with them, under their care, with me managing. And there's another one in Europe. It's the Clinical Kidney Journal in 2015, acute kidney injury associated with androgenic steroids and nutritional supplements in bodybuilders. And this talks in one piece about this, FSGS. Because now if we look at the other causes of kidney failure, which this is going to be eliminated, we have to wrap it up, is, so men that use anabolic steroids, I'm always talking about the heart health. Kidney health is interesting, it's in there too, but it's kind of quite arcane. We know that anabolic steroids can cause hypertension. You presented in hypertension in acute renal failure, which is acute on chronic. Is the hypertension the cause from steroids? What's the mechanism? So the mechanism in the anabolic steroid in these studies is either secondary to the steroids causing blood pressure and other issues, and directly on the kidney. It's called the nephron. How does it work directly? Now, I won't bore everyone with the pathology results, which we're going to talk about later, and try to maintain and see if your pathology reports are really clear that you really have FSGS. But beyond that, does tren cause kidney disease? How much tren? Is it an acetate or an xanthate? Is it decadurabolin? Is it the years of testosterone? Well, wait a minute. There's millions of men that use TRT. Wait a minute. Testosterone replacement versus steroids. What is that? Dose? Is it propionate? Is it an xanthate? Cypionate? Suspension? Got a lot of questions here, right?
Yeah.
So I'm here to figure it out. But it does appear to me that your anabolic steroid use certainly could have led to your kidney demise. And in God's will, we're going to try to stabilize it, which I think we're doing, and back it off. How are we going to do that? Let's talk about that for the treatment people that want to hear, what are you doing for them? Tell us what we're doing. Start that off.
When I was discharged from the hospital, I was released with 5 different types of blood pressure medicine.
So hypertension treatment, number 1.
And I started what is called a DASH diet, which is low protein, low potassium, low phosphate. During that time, I started doing a lot of cardiovascular exercising, I walk a fast-paced mile every morning, 16 minutes. I've been in the gym most of my life. I can't stand a treadmill or elliptical or anything like that. I have to be in the outdoors, so I do my mile outside. And then once a week, either a Saturday or a Sunday, I'll do 3 miles. And since January 20th, today's April 26th, I've lost 55 pounds.
Incredible. 55 pounds. So you were how much?
276 at 5'7".
Oh, God.
But I do no more compound movements either. So I do not train heavy. I do circuit training with very moderate light weights, 3, maybe 4 days a week.
Wow.
That, along with the diet and the medications, where I'm at now, all my levels have dropped.
So, and it's interesting, again, with the etiology, with the cause of this, it's also thought that heavy weightlifting, that this is toxic.
Yes.
We don't know. But, you know, when you look at the causes, if you have rhabdomyolysis, if someone has a massive crush injury, that all the breakdown of the muscle tissue from a trauma is certainly renal toxic. You know, we talked about all this. I mean, it's all, there's the causes, we have to vet them what they are, and then of course back off what we can. And you stop using anabolic steroids.
I still use HRT.
So now this
testosterone.
is a big point today. So this is a big point. His doctor, he's got some great doctors down there. This board certified nephrologist, I think, is doing a great job. That nephrologist clearly understands he's not an expert in taking care of men, is an internist on steroids. That's why he agrees referring to me.
Correct.
We're going to work as a team. I'm not a nephrologist. He's not an expert on steroids. We work together. He actually says in his notes, question, stop steroids, yes. Everyone agrees, stop testosterone. I will disagree. So you have another condition, you have another medical condition that I'm an expert in for many years, anabolic steroid-induced hypogonadism. You use steroids and mainly testosterone derivatives for so long that your pituitary gland and your testicles are disconnected. Correct. Now, you understand that, and we can diagnose that very easily. You've come off testosterone for periods of time. What's the number of testosterone when they test, and how do you feel?
Terrible.
So, and we're not going to go into, it's not a rhetorical interview, but this interview is not about anabolic steroid-induced hypogonadism.
Right.
This is about anabolic steroids causing focal segmental glomerulosclerosis, potentially in kidney damage, and what we can do about it. So this is educational. So in the end, so the nephrology expert said lose weight, because mass effect, protein. It does come up in my mind what can cause this and what could cause this. Too much protein. Damage bodybuilders. What's the level? 1.5 to 2 grams per kilogram body weight. I'm not going to argue it. I can't stand these arguments of people. It's stupid. It's dumb. Now you need to follow that. So before you have kidney disease, is protein toxic? I'm not going to talk about it. It's stupid. We don't really know. I've talked to experts, nephrology guys, they're not really know. So, but it stresses the kidney. By deamination, and it's breaking. The kidney has to process it, and you want to ease your kidneys down. And you're doing a great job. Creatinine's dropped down from. Creatinine was 6.9
down to 4.1.
Doing great. We're going to be great. And we're, at the grace of God, we're trying to keep you from dialysis and kidney failure. You know that.
Right.
Serious stuff. So
that's why I'm here.
And kidney transplant. So we hope we can do it, and we're going to follow all the evidence-based guidelines, and we're going to do the best we can. I have hopes for you, but I'm going to work with the experts and just coordinate the whole thing.
Right.
So in the end, too much protein can cause it. Non-steroidal anti-inflammatory drugs. Forget the other drugs. We got to go into those. Guys are killing their kidneys with just Motrin. Tell me about the Motrin.
Over the last probably 2 years, I've noticed that my joints started hurting more when I trained. When I would do a barbell bench press, it felt like spikes sticking in my wrists, my elbows, and my shoulders. So I would turn around and take 800 milligrams of ibuprofen.
And you could use, again, this is not medical advice, but if you look for ibuprofen, it's a non-steroidal anti-inflammatory. People need it. Of course, people need it. Up to 3 to 4 grams a day is considered safe. They went from 4 to 3. Someone who has a sensitive kidney, or not to mention a sensitive heart, shouldn't be doing any of this, right?
Right.
Okay. So
I know that now.
Let's get moving. And did that cause, in addition, in my world here in this room, it's multifactorial. I mean, there's never just one thing. Steroids definitely played a role. You have some genetics, too much protein, you're too big, you had hypertension with secondary from it all, and then that all caused your kidneys in the end to be where they are today. So let's talk about, in the conclusion, what can men do? Because I'm going to take care of you. What can men do? I can tell you what men can do. Men can come and see me. Obviously, I'm expanding my practice over time. We have some good news about a big study we're going to be engaging soon. We'll go into it later. You can check your basic labs, comprehensive metabolic panel, with any physician. You can get educated on that. You could follow your comprehensive metabolic. If you saw that your creatinine was elevated over years, over a period, or certainly can see an expert and figure it out and investigate it. You can follow your blood pressure, basic things. Of course, don't do steroids. I'm telling people, you do steroids. My last article in Muscular Development, no free lunch. There's just no free lunch, and you agree with it. So in that conclusion, I don't give a blessing on steroids. Steroids may have just indeed played a role in your kidney demise. Let's move on now and not do steroids and do the best we can to improve and to save you, and so you do well and you keep your kidneys. I have hope for this. And then let's educate guys. If they're going to do steroids, they're going to pay. Okay? Now, that's my conclusion. That's all I have to say. What is your closing? What do you have to say about that? Your steroid use. Would you do it again?
That was the same question my wife asked me. Would I do it all again, knowing what I know now? I would do it in a different way.
Okay.
I would be more careful medically. I would, instead of going behind the scenes and underground the way I did it over the years, I would be more upfront with doctors. That was one of the reasons why my condition advanced to the way it was, because I could not be upfront with doctors.
That's why we're doing this.
I would, anytime, I mean, when I lived in Florida, I had no problem. I had an endocrinologist that worked with me whenever I would do steroid cycles, and he would monitor me closely and help me and give me suggestions on what to do and what not to do. When I moved back to Mississippi, where I'm from, there was no doctors educated in anabolics. And anytime I'd try to talk to it, I had the door slammed in my face.
And this is what, again, I have to be very careful. I can't give a blessing on steroids. I'm simply giving educational advice and saying that if we're taking care of people in this world, from transgenders, to people that are using opioids, that have alcohol problems, this is another big group of people, and I'm not saying those are sick people, people that have, if they have medical consequences from something they're doing, they need to talk to a doctor.
Exactly.
It's simple, bottom line. That's all I'm saying.
Yeah, I agree.
Joe, that's it. Thank you so much for coming on, and I hope this could be spread across the world and help anyone using steroids to see a doctor and make sure they stay healthy. Thank you so much. Thomas O'Connor here. I'm glad you made it to the end of the video. If you liked it, hit the like button and please subscribe to our channel. And I look forward to bringing you more cool and interesting videos just like this in the future. Stay strong and healthy.